Today we're going to talk a little bit about nuclear medicine imaging. So nuclear medicine imaging is just a little bit different than what we've discussed in the past. It's different than the other modalities. Earlier we learned about X-rays and CT and how they create images by passing those X-rays through the body. So they're actually passing radiation or X-rays through the body. Nuclear medicine is slightly different because what it does is it uses a radioactive material called a radiopharmaceutical, or referred to as tracers. So those are either injected into the body, into the bloodstream, swallowed, or inhaled as a gas. So these materials will accumulate in the body in areas where it gives off a small amount of energy in the form of gamma rays. So the special cameras used in nuclear medicine, they're detecting this energy, and with the help of the computer, they create pictures that offer the details on the structure and the function of the organs and tissues. So with regular X-rays, we're passing radiation through the body and using that to acquire images. With nuclear medicine, we're putting radiation into the body either through an IV, ingesting it, or inhaling it, and then the camera itself is picking up those gamma rays out of the body. So it's almost backwards. The body is emitting the radiation and the camera is picking it up instead of the camera emitting the radiation. So the history of nuclear medicine, it began about 70 years ago and is now a vital part of diagnostic imaging for diagnosis and for therapy. So the origin of nuclear medicine stems from many scientific discoveries, one being X-rays in 1895, and the discovery of artificial radioactivity around the 1930s. So without those two things, we wouldn't have nuclear medicine today. Artificial radioactivity is man-made. Radioactivity, the first clinical use was in 1937. So the major event that kind of helped launch nuclear medicine occurred in 1946 when a cancer patient that had thyroid cancer was having treatments with radioactive iodine, and that led to the complete disappearance of that patient's cancer. So that's when they started to realize that, wow, nuclear medicine, held a lot of weight in this diagnostic imaging community where they could not only diagnose things but possibly treat them as well. So in the 1950s, its use increased to measure the function of the thyroid and to diagnose thyroid disease. Also, treating patients with hyperthyroidism. So that's kind of where it first started. Nuclear medicine mainly just focused on the thyroid in the very beginning. And as you can see from this machine here, this was one of the very first nuclear medicine machines, and it's pointing directly at the patient's thyroid. That was its main purpose. So the gamma camera, which is what we use for nuclear medicine, was first used in the 1950s. So in the 1950s, the gamma camera was first used. Around in the 1970s, they started visualizing additional organs besides the thyroids. They were looking at the liver, the spleen, brain, tumors. They were using it for tumor localization, and they were also looking at the GI tract. And then around the 1980s, they started diagnosing heart disease. But several advancements have taken place over the years that have followed and continuing to improve. There's still new advancements in nuclear medicine. Today, like they started out with just basically imaging the thyroid. Today, there's over 100 different nuclear medicine imaging procedures, which provide about an image of nearly every organ possible or system. So what is nuclear medicine? Nuclear medicine is essentially a branch of radiology. Sometimes it's referred to as radionuclide scanning, or a lot of times just nuke med, which is short for nuclear medicine. That's what I tend to refer to it as nuke med, just because it's short and easy. But nuclear medicine studies require the oral or IV introduction of very low levels of radioactive chemicals called radionuclides, or radiopharmaceuticals, or tracers. They kind of use all the terms interchangeably. So those have to be introduced into the body for nuclear medicine to work. So the radiopharmaceuticals are specifically formulated to be collected temporarily in the specific body part that needs to be studied. So the heart, or the lungs, or the liver, whatever it is that they're trying to visualize. And then what happens is those radionuclides are taken up, that's what they call it the uptake, by the organs in the body, and then they emit a faint radiation signal, which are measured by the gamma camera in nuclear medicine. So like I said before, the difference between X-ray, CT, and nuclear medicine is that the nuke med camera does not emit radiation. It picks it up from the radiation that's within the body from the radiopharmaceuticals that were inhaled, ingested, or injected. So the gamma camera is actually made of a large crystal detector. It's called a Scintillon crystal. So these crystals actually detect the emitted radiation signal that's coming from the body, and then they convert that signal into a faint light. Then that light is converted into an electrical signal, which is then digitized or converted into a computer signal, and then reconstructed onto an image by the computer. So, you know, all of that kind of takes place behind the scenes. So even though the radiation is different, the amount is less than or comparable to general x-rays. Most of the time it's even less than a standard x-ray would be. So the nuclear medicine machines are different, like I said, because they use a gamma camera. They're not emitting radiation, but they look similar to a couple different machines. They kind of look similar to a CT machine. Some of them look similar to an x-ray machine and a combination of x-ray and CT. It's just going to depend on the facility and what they have. So for nuclear medicine to work, like I said, we've got the radiopharmaceuticals that we talked about that are either ingested, and by ingested you can take them as a pill. Sometimes they mix them in with a scrambled egg, which absolutely sounds horrifically disgusting to me. I can't, the thought of eating a scrambled egg with radiopharmaceuticals in it for some reason just disgusts me. But there's the ingested, like I said, pills or the eggs. You can inhale it. It's like a gas that you inhale. It doesn't even really smell like anything. It doesn't affect your sense of smell or anything like that, but we use those sometimes when we're scanning the lungs to try to see how it goes through the airways. And then also it can be injected through an IV, an intravenous injection, which is the most common one. I've had a nuclear medicine scan before. I've had a bone scan, and they did inject the radiopharmaceuticals into me for the scan. So with nuke med, because of the way that the radiopharmaceuticals are introduced into the body and the uptake and how they go to that specific region, nuclear medicine provides very unique information that can't usually be obtained using any of the other imaging procedures that we have. And it offers the potential to identify these diseases in some of its earliest stage, which is really important, right? When we're dealing with infection, disease, cancer, we want to find it as soon as possible so that we can treat it. It ups our odds of getting a better treatment, right? So the also uses a gamma camera. So in nuclear medicine, we can use a gamma camera or a PET scanner. So they're two different things, and most of the time, the PET scanners are used in much larger areas. So the gamma camera, like I said before, it's also called a Scintillon camera because of the crystal inside. It detects radioactive energy that is emitted from the patient's body, and it converts it into that image. Again, the camera does not emit radiation. So with the SPECT gamma camera, which SPECT stands for single photon emission computed tomography, which a lot of people, because it stands for, like I said, single photon emission computed tomography, a lot of people think, well, is it CT? But it's not, because a CT scanner emits radiation, and this is made with a gamma camera, which does not. So that SPECT camera can be a little bit different. The patient lays on the table, which slides in and out of the gantry or the donut hole, like we've seen in a CT scanner before. And the patient's positioned between usually two gamma camera heads. They're like a flat panel, and they usually are parallel to each other. And they're positioned above and sometimes below the patient, and then they can rotate at a 90-degree angle. So they're a little bit different. Some of them only have one little camera, but most of them now have two. But I think I think one of the first original pictures I showed you was from an old scanner that only had one on it. So SPECT imaging involves the rotation of the gamma camera heads around the patient or the body part to produce a more detailed 3D image. So a PET scanner looks very similar to a CT or MRI scanner. They have that big hole or opening, the aperture in the center, and then they have multiple detectors inside the machine that kind of record the emissions from those radio tracers that are injected into your body. The PET scan uses cross-sectional data or slices, very similar to CT again, but like I said, it's still a nuclear medicine study. So a computer is also necessary when it comes to nuclear medicine imaging to help create those images from the data that's obtained from the camera. So the difference between nuke med compared to other imaging modalities is that nuclear medicine focuses on the processes within the body. For example, it's looking at the rate of metabolism or levels of other various chemical activity. So where there's areas of greater intensity inside the body, those are called hot spots. Those indicate and show us where there's large amounts of the radio tracers, where they've accumulated, and where there's a high level of chemical or metabolic activity, which is showing us where there might be an infection or cancer. And then where there's less intense areas, those are called cold spots, and they indicate a smaller concentration of the radio tracers or less activity. So this slide will show you a couple different things. So here is a little illustration of what nuclear medicine does that's different. So see here they show the IV and the syringe where they're putting the radiopharmaceuticals into the patient, and then they're coming out of the patient. It's those radiopharmaceuticals are emitting out of the patient, and then the gamma camera is picking them up and it's converting them onto a display monitor. This is the gamma camera right here. So the patient, there's this table here, it's out of the machine right now, but it can slide all the way into this opening here. And this camera is going to rotate around the patient to take images. This is an older one, which is why it only has one gamma camera as opposed to two. The next slide here, this was a newer one. So this one's a little bit newer. This one shows two gamma cameras, and then you've got the aperture or the donut hole here where the patient can slide all the way in, and those scanners can just rotate right around the table. As you can see here, some of the cameras get really close to the patient. Nuclear medicine scans are very low resolution images. They're not meant to have a high resolution. They're not meant to be super clear. They're meant to show the hot and cold spots. So even to get those images, because it's a lower dose of radiation that the patient's emitting, these cameras get kind of close to the patient. So some patients who are claustrophobic, that can be a problem for. This is a PET scanner. So like I said before, it looks very similar to a CT machine or an MRI machine. All of the detectors, that the gamma camera detectors, are inside of here, so you don't see it externally like the SPECT scanner. So the pertinence to the medical community is that physicians can use nuclear medicine imaging to visualize the structures and function of an organ, tissues, bone, or different systems within our body. It provides excellent evaluation of the function of our anatomy, the cardiovascular system, so it can visualize the heart, blood flow, and function. It can detect coronary artery disease. It can assess damage to the heart after a heart attack. And it can also detect heart transplant rejections and more. It's also good at looking at the respiratory system, looking at the lungs, so it can scan for respiration issues, blood flow problems. It can detect, again, lung transplant rejection. It's good at visualizing the musculoskeletal system, so bones, brain, and much, much more. So with the bones, it'll show fractures, infections, arthritis. We can evaluate for metastatic bone disease, bone tumors. We can use it to guide for biopsies. Brain, we can investigate abnormalities in the brain of patients that maybe had seizures or not medical, memory loss, sorry. And it can also detect early onset neurological disorders or assist in surgical planning and evaluate suspected brain tumors. So nuclear medicine plays a vital role in diagnostic imaging, especially when diagnosing cancer and other diseases. So this image here is showing what a nuclear medicine SPECT bone scan looks like. So like I said before, these are very low resolution images, right? I mean, you can almost not even see the outline of the skull here. But what a bone scan is it's used to identify areas of physical and chemical changes in the bone. So it can show cancers and if they've spread to other areas of the bones. So like I said before, you might want to remember this. As you can see, nuclear medicine images are very low resolution images. So this scan shows the tracer uptakes in the liver. So you can see the liver here, right? All of those radiopharmaceuticals have accumulated there in the liver. That's one of the most common causes is metastatic disease when you find those the tracer uptakes in the liver. So these spots here, when I talked about the hot spots and cold spots, it said that the hot spots are white and cold spots are black, but this image is inverted, so it's going to depend. So these hot spots are black on this image. So you've got some spots up here in the shoulders, in here in the liver, and then in the hips and pelvis. Let's see, so right here even too is kind of the hip joints. They've kind of removed all the other anatomy so you could see those more clearly. So this patient has metastatic cancers that can suggest cancer, but it can also show arthritis, infection, and other bone diseases. So SPECT is that single photon emission computed tomography, but it is nuclear medicine, it's not CT. They use those gamma cameras which rotate around the patient, and then that uses the computer to reconstruct the images similar to a PET scan. But the thing with SPECT and PET is PET scans tend to be more sensitive than SPECT scans so that they can pick up abnormalities a lot easier. They can find cancers a little bit more easier, but then they tend to be much more expensive than SPECT scanners. So a lot of times PET is only available in large medical centers. It has to be a pretty big hospital for them to have an on-site PET scanner. I don't even think Henry Ford Allegiance does. I'm trying to think for sure, but a lot of times if they don't have them on site, what they'll do is they'll haul them in a semi-trailer, like once a month or once every couple weeks or once a week, and they'll set up the semi there and they can bring patients right out to the semi-trailer and scan them there. So then that trailer moves around to a bunch of different locations at different hospitals for people to get PET scans in an area where it wouldn't otherwise be available. So these are some PET scan images of the brain. So they'll show the function of the brain. It captures activity of the brain after those radio tracers have been absorbed into the bloodstream. So the images appear as multicolored images ranging from dark blue to a deep red. So areas where the active brain activity comes up in warmer colors like the red and yellow. And then a brain tumor will usually show up darker, as well as Alzheimer's and dementia. Those have larger areas that are darker. So like this area here, I have an image I'll show you later, but there would be a larger dark area that would indicate Alzheimer's or dementia. The dark areas signify areas of the brain that have been impaired. Alright, so PET scan or positive emission tomography is what PET scan stands for. So most people assume PET is a type of X-ray or CT, but it is still a type of nuclear medicine. PET scan uses cross-sectional anatomy, very similar to CT scans, but PET scans have a very specific potential in imaging. Certain brain and heart disease or disorders are very easily to depict on PET scan. There's also a new lung cancer imaging where a patient inhales the radionuclides just like in SPECT scanning, but it can give a very detailed information about the lungs. We use PET scan to study epilepsy, evaluate strokes, to study dementia. It's used to image and evaluate brain tumors. It's used to evaluate coronary artery disease and to differentiate between recurrent active tumor growth and dead tissue masses in the cancer treatment. So there's a lot of different things that PET scan's good for, but they're not just going to start out there. They're going to start out with different imaging modalities or start out with SPECT scan, and then they would go to a PET scan if necessary. So I said this earlier, but nuclear medicine can image and show the function of a variety of different organs and body parts to help diagnose a number of different medical conditions. Remember, nuclear medicine offers approximately 100 exams. So we can scan the abdomen, and that's going to check for things like gastrointestinal bleeding. The brain, we're using it to look for tumors or aneurysms, or we can study or look for signs of dementia or Alzheimer's. We can use it to check the blood, to test for different blood cell disorders, the breast for imaging breast cancer to see if it's metastasized, hepatobiliary system, which checks the gallbladder and the bile ducts and how they're functioning, the heart, like I said earlier, to look for coronary artery disease. We can check the kidneys for renal function, tumors, and test for any kidney transplant rejection. Liver and spleen, they're checking for cirrhosis of the liver or metastatic cancer. Lungs, they might want to look for things like a pulmonary embolism, a PE, lung transplant rejection, or even smoke inhalation in burn victims. The skeletal system, they're using that to check for a lot of metastatic cancers or bone trauma in sports injuries. I have an image later that I'll show you. Sometimes trauma or injuries in the bone can hide and they're not visualized on other things, but you can see them on a SPECT scan. They'll also use it for the stomach to check for any stomach function. They can watch the stomach empty, confirm ulcers or cancer, and then the thyroid to check for tumors or abnormal functions. And those are just a small portion. Like I said, there's over 100 different exams. So nuclear medicine has a wide range of things that they're capable of seeing and doing. The most frequent exams, though, are going to be a bone scan, which again can diagnose a number of different bone conditions. The cardiac scan, which can evaluate the heart for coronary artery disease and cardiomyopathy. The stress test shows blood flow to your heart while at rest, and then stress to show damage or poor flow even. The HIDA scan, which is used to view the liver, gallbladder, bile ducts, and the small intestine. Or the thyroid scan, which again measures your thyroid's processes, checks for lumps, overactivity, underactivity, goiters, or even cancer. So most frequent exams are bone scans, cardiac scans, stress test, HIDA scans, and thyroid scans. The prep for the exams are going to vary. So there's many different preps because there's over 100 different studies. So not every scan is going to have the same prep. So some of the more basic ones, you want to know the ones that don't require any prep at all would be a bone scan, lungs, or brain. You don't have to do anything prior to those. There's no prep involved. The renal scans, when you're checking the kidney function, they're going to ask you to drink about 2 glasses of water prior to the scan. But unlike an ultrasound where you have to hold it, with these you can go. They're actually trying to flush the kidneys out so that they can have a cleared out kidney with nothing in there when they go and put those radionuclides in there. And then they'll actually have you drink a lot of water after the scan as well to flush all that out of your system. Gastric emptying studies, those are done to determine how quickly food leaves your stomach. So the patient will need to be NPO for 12 hours prior to that to ensure that the stomach is completely empty. And then the thyroid scan, The only prep for that is they don't want the patients taking their thyroid medication because the thyroid medication alters how the thyroid is actually functioning, so they want to see it on a normal level without medication. So depending on the type of medication you're taking, they may have you quit taking it for 5 days or 4 weeks, depending on what it is you take. The prep for the white blood cell count scan is a little bit different. So the white blood cell scan is used to detect abscesses, infection in soft tissue, or the skeleton, or even if you have a fever and they don't know where it's coming from. And what they do for that white blood cell test is they actually remove white blood cells from the patient, and then they tag them with radioisotopes, and then they inject them intravenously back into the patient, and then those tagged white blood cells localize in the area of the infection. They go to try to fight off that infection so they can see where it's at. So while that test doesn't necessarily have prep, it is a 2-day test, and you have to come in the one day for them to extract the white blood cells, and the next day for them to put them back in. So nuclear medicine is used to help better visualize organs and areas within the organs that can't be seen on regular x-rays. Especially tumors, they really stand out very well in nuclear medicine scanning. So earlier I talked about the cold spots and the hot spots, and again, the cold spots are areas that absorb very little of the radionuclides or no amount of tracers appear. And that looks dark on the image. So it could indicate lack of blood supply to the bone or certain types of cancer. The hot spots are areas of fast bone growth or repair, and they absorb more of the tracers. So it shows up on the image as bright white or a hot spot. So this could be arthritis, a tumor, a fracture, or an infection. But remember, in some of the images, like I said, they're a little bit inverted. So the hot spots might actually look dark. So in cardiac sonography, we talked about a stress echo test using sonography, right? Well, nuclear medicine is also important in the diagnosis and treatment of heart disease. So they actually do a different type of stress test. It's called a stress thallium test. And in this, they perform it just a little bit different. In nuke med, when they perform a stress thallium test, it shows the function of the myocardium, which is the heart muscle. So just like a stress echo, the stress thallium is performed in 2 different data acquisitions. So the difference being, when we do them in ultrasound, the patient comes in, they do the resting echo, that's performed first, then they stress the heart by having them walk on the treadmill, and then a second echo is performed when the heart is stressed. So in the nuke med stress test, or stress thallium, the patient is vigorously exercised first on a treadmill to stress the heart, and then they're immediately scanned while that heart's already stressed. And then they have the patient rest, and after that heart rate becomes normal, then they do a second nuclear scan. So this will help show the areas of the heart where previous damage by a heart attack or other areas that may have insufficient blood supply, maybe due to a blockage, those things are going to show up a lot easier on that. So this next slide here is what it looks like. So these show the different slices that we're looking at. So the normal tests are here on the top. So this is a normal test. Shows there's sufficient and unrestricted blood flow in the heart. And then the abnormal results are below. So on the bottom it shows where the insufficient blood flow, and it indicates some level of coronary artery disease. And this one just represents 3 different views that we take. So this one is like an axial view, and you're looking at the left ventricle here. This one you're looking at the right atrium, right ventricle, left ventricle. And then this one you're looking at both of the ventricles here. So it kind of shows you the slice of the heart that you're looking at and how it's laid out. So you've got normal at the top and abnormal at the bottom. This is what an entire stress thallium scan looks like, okay? So you've got all of the different slices here of the 3 different views. So 1 view, 2 views, 3 views here. So, and it's all the different slices at the different level through the heart. this is how it's laid out in a normal situation when the radiologist looks at them. So benefits and risks for nuclear medicine. When it comes to nuclear medicine, the benefits definitely outweigh the risks, but many people are still nervous about the fact that you're injecting a radioactive material into your body. You know, when you say, oh, we're going to inject a radioactive material into your body, it kind of freaks you out just a little bit. But there is a very minimal risk. So the benefits to nuke med is that it offers the potential to identify these diseases in its earliest stage, which gives better treatment options, right? So the functional information provided by nuclear medicine is very unique. And today, it's pretty much unattainable by any other imaging procedures that we have. It's less expensive and less traumatic for patients than exploratory surgery. I mean, if you give me the option with injecting me with a radionuclide or even eating the nasty eggs versus opening me up and having surgery done because they don't know what's going on, I'm definitely going to take the nasty eggs. And also the allergic reactions are extremely rare. So that's a benefit because the allergic reactions are extremely rare. However, it's still considered a risk if you look down here because there is still the potential for the patient to have an allergic reaction. For the risks, we are exposing the patient to a small dose of radiation, right? So that is a risk. However, nuclear medicine has been used for over 6 decades, and they haven't found any long-term effects. So, I mean, that goes to say a lot about the safety of it. Pregnancy and breastfeeding is a risk, so we can expose these individuals, but it should be kept to a minimum. So if a woman's breastfeeding, obviously we don't want to pass any of those radiopharmaceuticals along to the infant. So a lot of times what they could do is just pump their breast milk until all that's out of their system. If the patient is pregnant, it's not an automatic we won't scan them. Most of the radionuclides, I think we talk about it a little bit later, it doesn't cross through the placenta to the baby. The risk is through the radiation exposure in the parent to the baby. So a lot of times the biggest risk is the bladder because that's where they pool. So a lot of times what they do is have the patient, if they do have to have a scan when they're pregnant, to drink a lot of water and keep that bladder empty, go to the bathroom frequently so that radiation isn't pooled in the bladder close to the baby. There are limitations for SPECT scanning and PET scanning. So limitations would be procedures are time consuming. It can take hours or days for those radiopharmaceuticals to accumulate in the body part of interest. This says imaging can take up to 3 hours to perform. That's a little outdated, some of the older scans. The actual imaging with today's scanners, the actual imaging portion of the exam takes approximately about 15 to 60 minutes. I mean, the whole procedure itself can take multiple days depending on what we're doing, like the white blood cell count. You know, the patient has to come in one day and then come back the next day. So, you know, that is a limitation. The limitation for PET scans are PET scans can actually give false results if the patient's chemical balances are not normal. And test results of diabetic patients or patients who have eaten a few hours before can have adverse effects on them as well. Side effects for nuclear medicine, really there is none. I mean, we'll list allergic reaction because there is a very small possibility, but it's extremely rare. Patient's perspective is going to depend on the individual, right, and what exam they're having done. They can rate from very easy to being exhausting. Sometimes they need multiple scans on multiple days, so they can be long exams or the days can feel long. And like I said, it's going to depend on the patient. I mean, there is something to having someone inject a radioactive substance into your body. I mean, it is a little freaky. Like I said, when I had it done, even though I know enough about it, there's still that thought in the back of your head, like, they're injecting, radiopharmaceuticals into me. So it just depends on each patient what their perspective is going to be, but the exam is done first by, getting your patient, getting the history, and then what we do is we give the patient their radio tracers, either through the IV, ingesting them, or inhaling them. Um, it can take anywhere from just several seconds or several days for those radio tracers to travel through the body and accumulate in the area where we're trying to look or study. So imaging may be done immediately after the injection, inhalation, or ingestion, or a couple hours later, or they might wait for days later. Um, it just depends on how long it takes those radio tracers to get to the area of interest. So it's going to depend on the scan. So when it's time for the imaging, the patient just has to lay on that table, and then, like I said, that table will move in and out of that gantry or the hole. And then the scanner is going to take a series of images. Like I said, it's going to rotate around that patient, and it could get fairly close to the patient. The patient needs to remain still. So that could be a problem if the patient is unable to lie still for the exam, because we do need to acquire those pictures without the patient moving. After the procedure, a small device may be passed over the body, which is going to measure levels of radioactivity. So, they need to make sure that the patient isn't emitting radiation where they could be around other people. Most of the time, shortly after the procedure is over, they're fine. When I had my scan and they injected it into me, I had no issues going home that day and being around my family. I wasn't exposing them to radiation because it had already kind of dissipated in my body. But there are some procedures where they do have to be quarantined away from, that word will always mean something different after 2020. But sometimes the patients will have to be removed around small children or other family members to keep from exposing them because they may actually be still emitting radiation. Cost of a nuclear medicine scan. The SPECT scans cost about $1,000 to $1,500, and those are most common. The PET scans are going to be a little bit more expensive. They're going to be about $1,500 to $2,500. Contraindications for the exams. A previous nuclear medicine exam, we don't want to give patient the radiopharmaceuticals multiple times. So if they've had a recent study, we're not going to do one for a little bit. We want to wait for all of those radiopharmaceuticals to dissipate and be out of their system first. We would not do a nuclear medicine scan if the patient had an upper GI, a CT with contrast, or a barium enema, because all of those would put contrast in the area and we wouldn't be able to visualize anatomy. Also, any exams that would require NPO or a cleared GI tract we would not perform. So I kind of already talked about this, but the TC99M is a type of, it's one of the radiopharmaceuticals that we use that does not cross over the placenta. So that radiation exposure to a pregnant, from a pregnant woman to her baby is through the bladder. So like I said, if the benefit outweighed the risk, they would still do the scan. They would just have the patient void frequently and not allow that bladder to fill up with radiopharmaceuticals. Technologist perspective, it's going to be a little bit different from person to person. A lot of nuclear medicine technologists really enjoy the patient interaction. You have a little bit more time with them as you're starting their IVs, starting their things, talking through them. The scans can be a little bit longer, or you're dealing with the patients for extended periods of time. So a lot of people really like that. It can be routine. It can be, a little bit not dangerous because we take all those measures, but you're handling radioactive material. So you have to be safe. You have to be good at what you're doing and be detail oriented so you're not exposing yourself or other people to harmful substances. You're going to have to cope with people or depressing hospital setting. It can be risky because you're starting IVs, so HIV and hepatitis. I actually have a video I want to show you guys of what is one of the nuclear medicine technologists in the hot lab. The hot lab is the area where they actually put together all the radiopharmaceuticals for the patient. So it's kind of different. So we wanted to give you a kind of a glimpse of what that's like. Give me just a second here.
Cincinnati Children's, when you come to the nuclear medicine department, you'll pass our hot lab. Families always ask, what is the hot lab? The hot lab is where we prepare our radioactive medicine that we use for pictures. We also store this medicine here. When we enter the hot lab, we wear our lab coats. The lab coats protect our bodies just in case some radioactive medicine escapes the syringe. We also wear something called a ring badge and a dosimeter. The ring badges monitor how much radiation we get to our hands, and the dosimeter monitors how much radiation we get to our bodies. When we draw up the medicine, we do it behind something called an L block. The L block is made up of lead and lead glass. It protects our eyes and bodies from the radiation. We then place the medicine in a dose calibrator, which tells us the quantity of medicine we have drawn up. Once we have the medicine ready, we put it in a lead shield and it's delivered to our patients in the camera room. After the patient gets the medicine, we have to bring the syringe back to the hot lab to put it in a special sharps container that is shielded with lead. The state of Ohio has strict regulations on how we dispose of our radioactive medicine. We keep the sharps container shielded in a room until all the radiation decays away. Due to these regulations, the hot lab has to be secured at all times. Only a handful of radiology employees have access with their work badge. The radioactive medicine we use is not harmful and there are no side effects. This medicine comes in different forms. We do tests where you eat a radioactive egg or swallow a pill, but most of our tests involve getting the medicine into a vein with a butterfly needle or IV catheter. Now that you have learned about our hot lab, hopefully you have a better understanding of what we do and how we help our patients in nuclear medicine.
So as you can see, what she's doing, there's a lot of safety involved with, bringing up and putting together all of the radiopharmaceuticals that you need for each patient. She was drawing up that amount in the syringe that she was going to give to the patient. And the hot lab's usually not right in the nuclear medicine suite. It's maybe just right next door. But anytime you transport that, she put it in that lead-lined syringe holder because that syringe would emit radiation carrying it. So for her to even hold it in her hand, she would be exposing her hand. That's why you put the lead-lined barrier device in between the syringe and her hand while she's carrying it. So the technologist's role is to prepare and administer the radioactive chemical compounds known as the radiopharmaceuticals like she was showing in there, whether it be through the IV, oral, or inhalation. They're going to perform the patient imaging procedures using the sophisticated radiation detecting instrumentation or the gamma cameras. And then they're going to accomplish the computer processing and image enhancements. They're going to analyze any biological specimens in the lab. They're going to provide images, data analysis, and patient info to the radiologist for interpretation. And they're one-on-one dealing with that patient. They're bringing the patient in, they're getting their history, they're talking to them the whole time. They're starting the IVs themselves, they're injecting the radiopharmaceuticals, they're imaging the patient, talking them through everything. So it's really one-on-one. I mean, if you work at larger facilities, like when I worked at Chelsea Hospital, there was only one nuclear medicine tech there per day. Bigger hospitals like Henry Ford Allegiance Nuclear Medicine, they're going to have multiple people there each day. One might be helping get the patient ready, the other one's scanning, so, it just depends on the facility that you work at. Who performs a nuclear medicine study? A registered radiologic technologist with nuclear medicine specialty. So, someone in nuclear medicine does not have to be a radiographer prior to that. So they can have their associate's or bachelor's degree in radiography or just in nuclear medicine. So it's 2 years of clinicals and didactic courses, and then you're going to pass your national board exam. So with nuclear medicine, it can be anywhere between a 2-year associate's degree or a bachelor's degree. And they are registered through the ARRT, and then they can have the initials RTN for nuclear medicine. There's also a nuclear medicine technology certification or board, which is the NMTCB, and the credentials are CNMT. So NMTCB stands for Nuclear Medicine Technology Certification Board. So if you're ever asked, nuclear medicine technologists are registered through, they're actually registered through the ARRT and the NMTCB. So it would be both. And then their credentials through the NMTCB would be CNMT, which would be Certified Nuclear Medicine Technologist. So like I said before, if you're asked nuclear medicine technologists are registered through, it would be both ARRT and NMTCB. Career advancements are going to be the same as every other modality: sales, education, manager, lead tech. Compensation, I didn't update this one. This one is still from 2007, but in 2007, the hourly wage was average about $33 an hour. Again, it's going to depend on where you live and your experience, but they make a pretty decent amount of money, more on the higher end of the diagnostic imaging department. There really aren't any ethical issues because that they're done at a hospital and the technologists have to be registered. There isn't really anything ethical that we need to be concerned about. Nuclear medicine also offers therapy procedures, so they can do therapy instead of just diagnosing patients. So RIT is radioimmunotherapy, which is a personalized cancer treatment that combines radiation therapy with immunotherapy. And there's also radioactive iodine therapy, which uses small amounts of radioactive material used to treat cancer, especially like thyroid cancer. So they can also use it for patients with non-Hodgkin's lymphoma who don't respond to chemotherapy. They can use the IRIT, the radioimmunotherapy. There's a lot of different things that they're finding nuclear medicine is good for. I mean, like I said, when it first started, it was just the thyroid. They were only using it to scan the thyroid. Then they realized they could use it to treat cancer in the thyroid. And then now they're using it for 100 different types of scans, and they're realizing that they can use it for therapy as well. So I feel like nuclear medicine has many more wonderful things to come, in the future. So speaking of the future of the modality, the development of new radiopharmaceuticals for diagnostic and therapeutic purposes, they're coming out with new radio tracers that will work even better. There's research and development of cancer detecting or cancer killing agents, such as genetically engineered antibodies. Antibodies are a defense system that identifies and neutralizes foreign objects like bacteria and viruses. So, I mean, they're hoping that they can use nuclear medicine to inject these antibodies and it will kill off whatever's attacking our body. So, if there's a bacteria, a virus, or cancer or something inside of there, these antibodies would act as that defense system to eradicate it. They're using PET and SPECT with CT and MRI, kind of a fusion images. Well, this says PET and MRI still in the works, but it's actually here. And I'll show you some of those images in just a little bit. So I'll stop this one right here, and then I'll come back and do the image one separately. It's short, so it won't be that long.